Good morning, Miami. Welcome to this Monday morning. I'm your host, Cristina Hernandez. Welcome to the Women to Women show. And today with me is Dr. Alvarez. She is with Dental Cosmetic Spa.
Hi, Christina.
Thanks.
Thank you for having me here
Thanks for
today.
being here. And so we want to talk a little bit about. She has an amazing story, in my opinion,
Thank
which is
you.
why we're here, and talk about how your background a little bit. Talk about how you started with Dental Cosmetic Spa, but let's start out with your background
Yeah,
first.
well,
Like,
I'm so happy to be here. Thanks for the opportunity.
awesome.
Yeah, it's been a long journey,
Yeah.
and I really like to talk about it because I was born in Cuba,
Uh-huh.
and I grew up in Venezuela. I graduated in Venezuela in 2004,
Mm-hmm.
and then I did a dental degree, to get my license here as an international student at Nova Southeastern University in 2011. So it's been a long journey, but I loved it.
And now you own Dental Cosmetic Spa, which is a
Right.
dentistry office on Geralda in the heart of Coral Gables. Talk about living the American dream. You're also a mom of two. You're managing a home, a business, a husband
Yes, it's
during the pandemic.
yes.
I mean, I'm
And also my husband is a dentist too, so
uh-huh.
we're kind of partner too. I think it has to be a balance. I
Yeah.
love what I'm doing. I graduate once I graduated, I got the office Dental Cosmetic Spa,
Mhm.
which is located at the beauty of Coral Gables.
Right
It's
in the
the
middle of
beauty city
Geralda.
of, yeah, middle of Geralda, and I loved it where the umbrellas were before.
Yes.
So yeah, it's I think it's a relationship. It's a
Mhm.
balance in between your life and other important things that you like and work.
Mhm.
Me as a mom, I think I establish priorities.
Mhm.
So my kids are my priorities, but I
Mhm.
love my work too.
Mhm.
So I think it has to be communication, and also communication. Um, Sometimes we, as a women, pretend to be a hero and do
Mhm.
everything. So we kind of like, I believe I try to share tasks with my
Mhm.
husband, and we also, we're kind of a
Mhm.
teamwork. And
It's true that, I mean, if anything has been more relevant during the pandemic is that it takes a village.
right.
And to accomplish what you've accomplished, I mean, being born in Cuba, then moving to Venezuela, both countries are in so much turmoil at the
Right
moment,
now, it's
especially
very,
Cuba.
yes.
I mean,
And it's sad. It's
it's
very sad, the whole process.
but then coming here and opening up a business.
I kind of like put, as I said, priorities first.
Yeah.
So my priorities at that moment, I didn't have any kids. So
Mm-hmm.
and I wasn't married at
Mm-hmm.
that time. So I kind of um, focused on studying and getting my degree first.
Did you always know that you wanted to be a
I
dentist?
always wanted to be, well, I always want to become a health provider,
Uh-huh.
or something on the health environment. And then I like just to focus on people mouth, even if it's an overall and everything, it's connected.
Yeah.
But I did. And even when I got here, I got other opportunities to become, owner of business and
Yeah.
everything. And I try not to, I try to concentrate on what I want.
Yeah.
And I think I did that thinking about myself,
Mm-hmm.
because it was, for me, it was improve, like a self improvement,
Yeah.
and also for my family. I
Mm-hmm.
believe after I came, my family came too.
Mm-hmm.
It was kind of a process.
Yeah.
And
We all have that story.
it's, yes,
We all have
and I
that
liked
story.
it. Now that I have my kids,
Mm-hmm.
I'm proud of what I'm doing, and I keep working on it. I think it's always a
And to
process, and
think
it's
that
still.
your kids have you and your husband that are immigrants and I mean, you've opened
The
your own
value,
business, but
right.
the values you're instilling in
The
them.
value, right.
And they're
And I
seeing you being a career mom, balancing this. It's a juggle. It's never easy.
I think it's also being persistent on what you
Yeah.
do, creating a habit. So I believe, as I said, I
Mm-hmm.
wanted to become a dentist. So I'm very persistent in what I
Mm-hmm.
do. So that makes me, happy, and hope, like, everything gets like benefits of it.
Yeah.
Dental Cosmetic Spa, it's a beautiful place. We loved what we do.
Yeah.
I love my work. I communicate with my employers, with everybody at the office. We try to care about patients too.
Yeah.
We try to teach them how to take care of your oral health, and
Mhm.
overall, that it's not only your mouth, it's everything, it's connected, and you're a human being.
Mhm.
So I try to talk to my patients. I give it a little time, and I give myself time to know my patients.
Mhm.
So I love what I do.
S- That's good. Let's talk about what kind of services at Dental Cosmetic Spa. What are all the things that
We
you
we
offer there?
we offer several. We concentrate on cosmetic dentistry
Mhm.
pretty much, but we also offer in implants. We
Mhm.
do extractions, oral surgery, and but our main focus it's cosmetic dentistry, and it's among this
Mhm.
it's dental veneers.
Okay.
So I wanted to talk about a little bit of dental veneers.
What are exactly veneers? Like, let's say I know nothing. I've heard of the word veneers, but what is it really?
Veneers are restoration. They're made. They're preparations that are made of porcelain or composite,
Mhm.
and they usually go placed on the front tooth surface,
Mhm.
on the front area or surface of the tooth,
Mhm.
and most of the time it's something very cosmetic.
Mhm.
It's something that it's used. It's usually placed when people have discolored teeth,
Mhm.
small cracks, fractures, or diastema, which is just gaps in between the teeth.
Mm.
And it's usually and it's very resistant to stains. It has very, but the mainly thing is that the preparation is minimal or none. So the preparation of the tooth has to be prepped, but it's like less 1 millimeter. So it's pretty much very, not invasive,
Right.
and it has a lot of people loved it, and it's something that it's made of probably within a week or two, and it's something that you get your temporaries. We
Mhm.
usually do a comprehensive exam first with the patients. I like to take some impressions like molds before, to show you how they're going to look before placing or before
Mhm.
touching the teeth, pretty
Mhm.
much. And it's and the good part about veneers are that they're made of very thin layers of porcelain,
Mhm.
that it can be semi-translucency, and at the same time it could be very like very reflect like very naturality,
Mhm.
with
Looks very
natural,
natural.
looks very natural, and it blends with your smile.
So do you attach then a new like look
Like
of
a
a
very,
tooth
yeah,
on
like a
top of a
very thin
tooth?
layer on the top of the tooth, right
Mhm.
on the front surface of the tooth. And it's usually we pick the shade. We don't,
Mhm.
once you have veneers, you can have like whitening on the rest of the teeth, but not on the veneers, because since they are made of porcelain, they're very stain resistant. So coffee, smoking, tea,
Tea.
they won't, yeah, they won't stain
That's
most of the
incredible.
time. Yeah, they're very attractive to patients.
Yeah. Do you also do teeth whitening?
We do teeth whitening. We usually, when the patient have like some fractures,
Mhm.
cracks on the teeth, they usually, what we do is we try to um, offer teeth whitening first to the rest of the teeth, and then one we get a final shade, and then we prep the teeth, for the veneers, and it's like kind of smile design too,
Mhm.
if you can call it. And every patient is unique, so
Mhm.
every patient is different. There is not a measurement for everybody. It's the same. It
Mhm.
depends on also your facial proportions,
Totally.
and your and patient expectations too.
Mhm. One of the things that I've also seen and that I've seen in social media also is the Invisalign, all of that. There's so many like companies, I guess now competing. It used to only be Invisalign, and now there's so many
Right. Yes.
others. But you
Correct.
offer.
I do Invisalign. I do Clean Lines. It's another great company too.
Mm-hmm.
We usually do, but sometimes the good part of the veneers that when
Okay.
you don't have, when it's very small imperfections, that you can fix with the veneers, and you don't really have to do Invisalign. Now,
Mm.
veneers are not going to treat ortho. In
Mhm.
other words, if there is like a big crowding of the
Mhm.
teeth, have like very big spaces, and it's no very, we're not able to do veneers first. I recommended Invisalign
Mhm.
first, orthodontic treatment, and then we can go to the veneers at the final, to see, depending on the patient expectations, at the final treatment of the Invisalign or the ortho treatment. If the patient wants to change those, the anatomy of the teeth, the color of
Yeah,
the teeth, get a lighter, and then we'll do veneers after.
that's awesome. I also noticed on your website that you help patients, not help, but you offer plans for people that don't have insurance. I know personally, like I avoided going to the dentist. Not that I avoided, but I didn't go because I was so scared it was going to be so expensive. And then I was at your office and I was like, look at all the options. I could have been going to the dentist because there's at least you can get your teeth cleaned, do the x-rays kind of. And I saw that you offer that for patients that don't have
Yes,
insurance.
we do offer. We have like inside, like in office, treatment plan, like treatment plans,
I saw that. It was
payment plans.
great. And I
Yeah,
wish I would have looked into that more, like
right.
because I
I
was without.
I also believe that people has to know that dental, everything with the teeth, with your mouth, we don't look it up until it's kind of an emergency
I
most of the
know.
time, because obviously we have other, priorities,
Hmm.
and we have a social life, and we have kids and family. And it's, I believe, for everybody it's the same, and if you don't have a dental insurance, it's even harder for you.
Right.
But I try to, once patients comes to me, I try to teach them about how important it's that your teeth and your gums and all your mouth, it's like, free of infection,
Yeah.
and one of the way that we try to retain our patients in a good way to say, because we try to offer, if you have to pay, by months, if
Right.
we can get a payment plan for you, if we can offer you according to what you can, your
Hmm.
needs, we try to get that, definitely, yes.
I think that's great. So as a mom, do you have problems getting your kids to brush their teeth?
Well, it's I
Maybe
tried
not because
since,
you're a
well, maybe I'm trying
dentist.
since little, since they were little. I was trying to push them so much that now I got them yesterday, actually, a new toothbrush, like
Yeah.
an electrical one with lights, and they're so into it right now. I'm just trying to push them. They're 6 and 8 years old, so
Yeah.
they're still little. So I'm
Mm,
trying just to push them to floss. And the
yes.
flossing, it's kind of a really hard, it's
Yes.
even harder for us sometimes, for the adults.
I
We
know.
don't have time, and but yeah, I tried to do it, and it's so, it's so funny, because I tried to give them some motivation, and I tell them, like, listen, if you don't brush your teeth, you're going to get cavities, and there's going to be a big hole. I don't want to scare them, but I have to tell them, like, everything what you do has an effect,
Yes.
cause and consequences.
Hmm.
So I try to give them a little advices for
That's what
that.
I'm struggling with at the
With the
moment.
flossing, oh,
Oh, with
as
the
a kid.
flossing, with the brushing, everything's a battle. I'm like, what do I do?
Well, I believe that when they get older, it's harder, right?
Yes.
Yeah, I think it's creating a habit now that they're little. It's
Right.
it's hard, but yeah.
It's a battle.
I so I was gonna mention about
Tell
when
me.
you said about the family,
Yes.
and a
How do
little
you
bit.
balance
It's
with two little
I think,
ones?
yes, I think I'm trying to get them understanding about participating on activities at home,
Yeah.
like creating a calendar, like a family calendar, and to do some task at home, the garbage, do some, the dishes. I mean, they're little, but at least they have
Right.
responsibilities
Uh-huh.
on doing something. So I think
Yes.
that's important. But I also believe My husband, it's a great man, and it's not because he's also Dr. Gutierrez. He works at the office at Dental
Oh,
Cosmetic
okay.
Spa.
Yes.
Yes, so he does like more root canals and concentrate,
Yes.
like focus more on surgeries. And we, as I said before, we work as a team at the
Mm-hmm.
office and at home. Like we try not to talk at home about work,
Mm-hmm.
but we definitely, share a lot of knowledge today together.
Yes.
And it's amazing because he, like I was doing activities for the for the office, and he can stay with the kids,
Yeah.
and then we can kind of like share tasks. We
Help
try
each
to,
other.
yeah, we sometimes we pretend to be a hero, and we're
Yeah.
not, like
Yeah.
we're not
No, we're not
alone.
perfect.
We are not perfect, and we need to, because if no, we got to stress. And I think that's one of the main issues as a human,
Yeah.
like as a person. You have to be happy with yourself, and
100%.
you have to dedicate, I think, like time for yourself,
Mm-hmm.
like give it a little, like give you a little time for you. And don't feel guilty when the kids are by them, like, because we're active women.
But one of the good things I think about being a dentist versus that you're in the healthcare, that you wanted to be a healthcare provider,
Right.
there is somewhat better work-life balance versus other doctors that have to be on call.
Right. Yes. I don't, yes, that definitely, that's one thing that it's positive. And even when I'm at the office, that
Hmm.
it's been most of the, Monday through
And
Friday
you're there the whole
until
time.
the whole time. So
Hmm.
it's sometimes I feel guilty.
Hmm.
And then sometimes I
The
feel,
guilt.
because the kids are not right.
Hmm.
The kids are, I'm not with the kids all the time.
Hmm.
But that's what I mentioned about sharing some task.
Hmm.
And when I'm with them, I try to give them quality time,
Yeah.
like being as a mom and quality and participating in activities and just be with them.
Yeah.
But it's, yeah.
I mean, running a business, being a mom, starting, I mean, like starting from new a business. I mean, these are like really big
It's a,
accomplishments
yes,
that your kids have, and you're a woman, and your kids have this as an example,
as an
and they see
example.
mommy working. She studied hard and she's worked hard. Daddy too. I mean, it takes a village, and you're leading by example and having that passion to keep going and
I
doing what you do every
Right. I
day.
try I try to give them that, like
Mhm.
every time that we have small conversation, I can talk to them about it. I try to reinforce that part.
Yeah.
And Dental Cosmetic Spa, it's been, and as you said, it's every day, a little by little,
Yeah.
little by little steps.
How long has Dental Cosmetic Spa been?
About 7, almost 8 years
Oh my
at
gosh.
Giralda.
Uh-huh.
Yes.
So they are right on Geralda, in front, where all the like you were saying, where the
Right.
umbrellas are. Couldn't be a nicer location.
It's a very nice location. I love that location, and people around, all my neighbors, it's most restaurants.
Yes.
And some of my neighbors are my patients too. So we're like, hi, good morning. Yeah, it's very, I liked it. I loved it.
It's easy to find parking. There's parking everywhere. I've never had any issue with the parking.
Right.
And your office is so nice, clean, small. I like the energy there.
Now that you mentioned that, it's with the whole COVID, pandemic, it
Yeah.
was obviously for everybody was
Yeah.
kind of a struggle and
Mhm.
very hard for, we probably had closed just for a month.
Mhm.
But as I said, communication with your employers too,
Mhm.
and with patients.
Mhm.
And then we open for emergencies. So we always been kind of like active. I always
Oh,
was like on call if
yes.
any emergency, any patient. So I think patient love that,
Yes.
that, and create a trust
So you were
with your,
really only open, I mean, closed
for the
during like
first
April, that
April,
first
May,
month.
first month in
Yeah.
there.
And
After that,
then May
we
15th is when some people were starting to open up again.
right, we open up back, and it was pretty much. I mean, obviously, people were scared,
Yeah.
and still people are scared. We
Mhm.
still have protocols. We still have tried to, we always had before as a
Yeah.
dentist. I think the the hygienist, the dental assistant, and myself are the ones that gets more in contact with patients,
Hmm.
and it could have like higher risk of getting any viral
Yeah.
disease, not
Yeah.
only
But you
COVID.
guys, I mean, I've seen you wear have like double masks
Yes, and
plus the face
plus the face
shield.
shield. Yeah, we were very protected.
Hmm.
We had like high level of protections of everywhere. And after each patient changing every, like the
Yeah.
chair and all the instruments, of course, sterilizing everything. It was
The
very
plexiglass when we
that we still
the
haven't.
receptionist.
Yes, we still have that.
Yeah.
Yes.
Yeah. I feel very safe there, and a s- I personally like small, more intimate offices.
Right.
Um, and I it's awesome. I love the location. I'm supporting a local business.
I believe, as I said at the beginning of the interview, I love what I do,
Mhm,
and been doing it for years. And I believe that since like when the patient kind of feel that cares that you
mhm,
care about it, I go to the weekends, like when I go to my house, I still think about patients, and if I have to call somebody,
mhm.
see how they're feeling, I do that, like I follow up. It's not that I do a procedure and then forget about the patients until next Monday. I try to be in contact with everybody.
Yeah,
So I think as long as that it's a plus for the
yeah,
for dental cosmetic spa.
totally. So now Dental Cosmetic Spa is on Geralda. And if we
Yes.
want to get in touch with Dental Cosmetic Spa, what is your phone number?
It's 786
Mhm.
452 1748.
And you can also find them on Instagram,
Gables,
dentalcosmeticspa.gables.
yes,
Also, you have the website,
correct.
dentalcosmeticspa.com. Um, and right there on Geralda, where all the little local restaurants are. It's so easy to find and awesome. Any other tips that we want to share with our audience about, like, what is the most important? I guess I would say it's probably brushing, but any other things that we can tell people?
Well, I believe what most important, I think it's when you start doing something, just keep doing it. Like brushing and
Yeah.
flossing, it's the most important, of course, but it's also to go. We were talking about veneers. So once you
Yes.
place the veneers, once you have a veneers, you have to do your maintenance. It's important to go
Okay.
back to the office. We usually, like and it's not only for veneers, it's
Mm-hmm.
only for hygiene.
Mm-hmm.
Once you start doing your cleaning, sometimes patients do their pro feed, their deep cleanings, and then they forgot about it within a year, or what happened with the pandemic. And it's important to keep doing to your maintenance, to keep going for x-rays. That's
Mm-hmm.
important to do.
Is that y'all specialty? Is it veneers? Are there other
Yes.
cosmetic? Um,
Well, we do crowns now. We got the scanner, digital scanner, so
mm-hmm,
the veneers and the crowns. And when we do implant crowns too,
mm-hmm,
we don't have to take impressions with the paste, with the
mm-hmm,
PVS. We usually do with the scanner.
mm-hmm.
It's just like a computer, like it's
Yes.
electrical. So we just do the scanner, it goes directly to the lab,
Mm-hmm.
and in a week or two it comes back from the lab.
I mean, you guys offer a lot of services.
We do
The
implants,
Yes,
restorative decays, removing cavities,
teeth cleaning,
teeth whitening.
teeth
Yes, I have a
whitening,
hygienist.
X-rays,
Yes,
every.
complete exam. Yeah.
Mm-hmm,
So it's a very complete. If there is anything that we don't offer, I do have a couple of like my specialties, like
mm-hmm.
my endodontics and my
Right.
periodontics. There are other um, specialties. I have a lot of great people that I
Mm-hmm,
communicate with. So I send them my oral surgery. So if anything, we'll definitely guide you through any specialty but you're not going to be alone. We usually take care of
mm-hmm.
of
Full
you as a patient.
disclosure, too, as you can tell, Dr. Alvarez is my dentist, and I
Yes.
have enjoyed going to her office. She has community newspapers in her office, and
We do.
I was
Yes.
like, this is local
Hey, listen.
supporting
Yes.
local community, shop local, and our hashtag is always like, that's community. So
Right,
when
I
I
know.
saw that, I was like, you need to come on our show and we need to talk about dental
I loved
cosmetic
it. I
spa.
loved it. And
So
it's mainly on the Giralda Street. It's
yeah,
mainly the only office in there. So I love that
because it's
too.
all restaurants.
Yeah, all restaurants. So I love that too.
I do too.
Thank you.
So since we're here talking about local, do you have a favorite local restaurant that we want to give a shout out to?
Well, I love the local. The
Yeah.
local for burgers is
Yes.
amazing.
I've heard.
Yes, it's
And I haven't
amazing.
tried those yet.
They're very good. And Clutch Burger. I love Clutch Burger too.
That
They're
one
my
too?
patients too. They're my patients. So I loved it. I try to eat healthy most of the time, but they do have healthy options.
Shout
too.
out to local, shout out to Clutch.
Yeah.
And any other things we want to
Well, I wanted to tell you that I believe, as you said, it's a dream come true, but it takes a lot of effort.
Yeah.
And some people out there that are thinking about become a dentist from another country, I always said, don't hear too many advices, or just select your advices, because sometimes people can talk about, oh, it's so hard, it's really hard to do it, it's difficult. I did it probably about um 12 years ago already. It's been a while, 15 years ago. And I believe that that was my best, my best option. Well, my best, what I choose.
Yeah,
that
what
was
did
my
you chose?
selection.
Yeah.
Right. So I loved it. And I think it has to be, you have to commit to yourself.
Yeah.
Pretty much, and do what you love to
Well,
do.
congratulations.
Thank you.
And it's all about hard work, and you're
Yes.
doing it, and you're living the dream, and you're a mom. And I'm just like, just put one foot in front of the other and keep
Yes,
going.
and
And
keep
when you
going.
believe in something, it's gonna
Yes,
happen.
and I see, and I believe that also attitude, it's very
Yeah,
important.
you've got
your
it.
attitude. It's
Your parents are proud.
My parents, yeah. I love my parents are proud. My family. My sister is an orthodontics.
Really?
So she's an orthodontics. Yeah, it's a little more up north.
Yeah. But that's
But it's,
awesome.
yeah, we're my her husband, it's also a general dentist.
Oh my
too.
gosh.
So we're all in the family. Yes. Doctor,
Keeping it all.
Yes.
All right. Well, thanks for being with us. Again, Dental Cosmetic Spa in the Gables. And they do everything from veneers. Well, it's a dental cosmetic spa, but you can also get your teeth cleaned there, cavities, root canals, crowns, you name it. They can do it.
We're going to wait for you. We're here for you, and we're going to help you as much as we can.
Awesome. Thank you for being with us.
Thank you, Cristina.
And we'll see you next week at the next Women to Women show. If you're a woman and you have a business you would like to promote, or a topic that you think we should be talking about, please get in touch with us. We'd love to hear from you. And we'll see you next Monday at 11 a.m. Thanks for watching. And
Thank
bye.
you.